Now we can hear from the WHO's Regional Director in Africa, Dr. Matshidiso Moeti, about the latest status in Africa. She says there has been a sharp rise in cases in the past week. There have been almost 1,000 deaths and more than 18,000 infections across Africa so far. Although these rates are far lower than those seen in parts of Europe and the United States, the WHO says the virus appears to be spreading away from African capitals. It also highlighted that the continent does not have enough ventilators to deal with the pandemic. So we hopefully should be praying never to get there. We can listen to her now.
So what is the situation currently in Africa now? We have now had reported over 17,000 cases, and we know that around 900 people have lost their lives due to COVID-19. We are concerned that the virus continues to spread geographically within countries, and the numbers continue to increase every day. We have countries like South Africa, Algeria, and Cameroon, which now account for around half of the confirmed cases. So the spread continues, particularly in Algeria and Cameroon. And we also have a number of countries like Burkina Faso, the Democratic Republic of the Congo, and Algeria, where the case fatality rate is rather high. So we would like to help those countries find out what is happening in terms of case management, caring for people, so that the quality of care can be improved and the numbers and proportion of those who are dying can be decreased. A number of African countries in the last week have seen a rather rapid increase in their case numbers. This is countries like Niger, Guinea, Cote d'Ivoire, and Cameroon. And this is just a reminder of the importance of continuing to implement the public health measures that we have now defined several times over and over again. Testing people, and we recognize that testing has become a challenge now because of the availability of test kits, contact tracing, and assuring effective quarantining of those who are infected, both the cases and those who are potentially infected, the contacts. This is absolutely important. We know that countries are putting in place measures for physical distancing and have observed that in some of our contexts in African countries, this is very difficult to enforce in all the contexts where people are living, as we've said before, in very crowded conditions. But I really like to emphasize the implementation of these measures for public health, and to also say we need to continue to strive to engage people at the grassroots level so that they understand what is the risk and they are able to figure out how they can best protect themselves and their families and the society at large based on the limitations and the challenges that they face in their families and their communities. I'm very pleased in relation to the challenges of testing to say that we've started to work with the World Food Programme, the government of Ethiopia and the African Union to distribute some supplies, including personal protective equipment for healthcare workers and some test kits, which are a combination of what WHO has procured at the global level and also another donation from the Jack Ma Foundation. So we are very appreciative of these contributions. Just to conclude, we understand very well that the impact in Africa will be very severe. We still have 14 African countries that have reported fewer than 20 cases. And I'd like to very much encourage that we seize this opportunity to contain and limit the spread out of the learnings that are occurring every day from the experiences of countries with more advanced forms of the pandemic.
The opportunity to learn from the mistakes of others for those 14 African countries especially. She has also been responding to the funding gap in Africa and the United States withdrawal or announced withdrawal of funds to the WHO as President Donald Trump did. Dr. Matshidiso Moeti says she's hoping that the US will reconsider that decision.
About $300 million. So in sub-Saharan Africa, in the African region, we have 47 countries, and each of the country offices has developed a plan of how they're going to work with the government locally. And then we have a regional office team that's working on this. And overall, we will be needing about $300 million for about 6 months in order to support what countries are doing. So this has been if you like, uploaded into the global WHO budget, and our colleagues are working at the global level then with different partners, donors, to see what are the resources coming in. I think more broadly, of course, WHO is a member state organization, and the United States is the #1 contributor to our budget. So for the last biennium, for example, we had a contribution in voluntary contributions, voluntary funds targeted to different program areas of about $151 million from the US. And we've already received for this biennium, which is starting this year, almost $50 million from the United States. So the impact potentially of this decision will be quite significant on areas such as polio eradication. We're on the way to having a declaration of certification of polio being eradicated from Africa. The US is one of the biggest supporters of that, as well as other priority programs that address communicable diseases such as HIV, malaria, and work on strengthening our health systems. So this I can describe as the extent of US contribution and the potential impact of this decision, which we are very much hoping will be rethought, because the US government is an important partner, not only in financial terms, but also it's an important strategic partner. We work with many of the technical institutions in the US. They're important players in WHO's policy making, strategy making, and we value the relationship with the United States.
Dr. Moeti there.